The COVID-19 pandemic presented the Northern Care Alliance with a number of challenges. We've got towards 20,000 staff in the organisation, and a large percentage of those staff needed to work off-site. I'm really proud of the way the staff have approached that and met that challenge, and we've continued to provide a really responsive service throughout.
One of the things we realised very early on was that there was going to be a lot of difficulty communicating with our PPE on. Our strategy for dealing with this was to get the Visera device. These devices can be used underneath PPE and they can be voice activated, so we can now communicate between teams across the hospital whilst we're dressed in our PPE.
We've been using Accurex now for about 2 weeks and think it's absolutely brilliant. We've been using it mainly with patients who have tinnitus, and we've been able to provide them with support and guidance.
You may know that during the COVID crisis, visitors can't come to the ICU, and this is specifically a very big problem during end-of-life treatment. Using the iPads, we've been able to take visitors into the ICU in a virtual manner and show them their relatives at some very difficult times.
We have been working at a furious pace to provide sustain cancer services using video, phone and also remote conference applications. We have carried out an impressive number of consultations.
I work with children who use communication aids, and up until now have been using video consultations to help parents make modifications on the children's devices and also to coach parents whilst they're playing with their child.
One of the things that's been most useful to us is Microsoft Teams. We've used it clinically to base our handover sheets within the Teams app. So now we can access our handover from any secure device, whether it's in the hot zone, inside where we're treating the COVID patients, or outside on our laptops or iPads in the cold zone.
For patients requiring interpreters, appointments are going ahead using video. The interpreter is at home using a laptop and video conferencing software.
We identified that there was a shortage of facial visors. We worked with the University of Salford initially to create 3 different prototypes working over 72 hours. We then scaled up manufacturing very quickly for us to be able to produce over 5,000 visors in 3 weeks.
The loan of 8 computers on wheels has greatly helped the working of the medical staff on the AMU.
It's more effective, more efficient, and you have a better relationship with your patient at the end.
The organisation has responded to COVID incredibly to enable people to come with us, and now they can actually see how things can work differently or optimise how they are currently delivering care. It just makes it easier now to be able to build on that.